Welcome to the Pharmacist Voice podcast, where we talk about pharmacy topics and careers so you feel connected to the profession of pharmacy and inspired to contribute to it. I am your host and Ohio pharmacist, Kim Newlove. This is episode 295, and you can find the show notes on thepharmacistvoice.com. September is Suicide Prevention Month, and today we're talking about suicide prevention training and resources with my guest, Austin Lucas from the Ohio Suicide Prevention Foundation. Austin serves as the program director for the Ohio Suicide Prevention Foundation, also known as OSPF. He manages suicide prevention programming, training, events, education, and resources for federal, state, and foundation grants. He is passionate about empowering communities to spread suicide prevention training, knowledge, and skills throughout their locality. During our interview, we talk about at least 7 things. They are number 1, how we met and what the Ohio Suicide Prevention Foundation is. Number 2, suicide prevention training opportunities for pharmacists. Number 3, how pharmacists, especially those in direct patient care roles, can spot warning signs and have effective conversations with patients at risk of suicide. Number 4, pharmacist suicide rates compared to the general working population. Number 5, coping strategies for stressed, burned out pharmacists who may be considering suicide. Number 6, resources, including the Voices for Suicide Prevention podcast. And finally, I've got a bonus today. We have a discussion at the very end after the wrap up, and I'll give you a hint. It's about suicide terminology and how it's changed over the years. Austin will tell you what you need to know. We cover a lot in our 40-minute interview. Without further ado, here's my conversation with Austin Lucas. Hi, Austin. Welcome to the Pharmacist Voice podcast.
Hello, Kim.
Good to have you with me. Last time we were face-to-face in person was in, April at the annual meeting of the Ohio Pharmacists Association in Columbus, Ohio. Good to see you again.
Good to see you as well.
When we were talking at the trade show, we put our heads together and we came up with some topics to talk about that will benefit my audience, who are pharmacists and pharmacy professionals. So I'm going to get right into it, if you don't mind.
Yeah, absolutely.
What exactly is OSPF?
OSPF stands for the Ohio Suicide Prevention Foundation, and we are a statewide nonprofit organization that provides suicide prevention trainings, programs, events, informational resources all across the state for all Ohioans, all different types of professionals, general community members. We work with various populations, and we also are able to advocate as well as a nonprofit organization. So we are involved in the advocacy efforts at the State House.
Awesome. I appreciate what you do. How did you end up at OPA, the annual meeting of the Ohio Pharmacists Association? I personally was surprised to see you there.
I know, and you weren't alone. I had a number of attendees come up to my booth and just ask, what's the connection? Why would suicide prevention be at our conference? When I looked around at the other booths there, most of them were pharmaceutical companies, pharmaceutical products, things like that. It appeared, because I took a walk around throughout the event space, and it appeared that we were kind of the only mental health focused related kind of nonprofit organization. So, how did I end up there? Actually, it was, kind of a series of circumstances that led me there. So sometime last year, I can't remember the exact date, but I attended a McKesson community event for just all types of community organizations working in Central Ohio. The McKesson was holding, and the whole purpose of this event was just to network with other organizations, right? And one of the keynote speakers actually was Dr. Emla Tubo, who went up there and spoke. And one of the takeaway messages from her keynote was to do not be afraid to reach out to another type of organization that you feel like just there's no natural connection there. The power of networking works across sectors, across different types of fields of study. Immediately, as soon as she got off the stage, I actually walked right up to her, introduced myself, said a little bit about suicide prevention, and said, we believe pharmacists, should be interested in the space of suicide prevention for various reasons. And we provide a lot of training, and we believe that some of our trainings would be very applicable to pharmacists, pharmacy students. And the conversation just went from there. And she said, "All right, yeah, reach out to me." And she said she's on the board of the Ohio Pharmacists Association, and she said, she definitely wanted me to attend the conference. I got the email really early this year that she wanted me to attend. She saved a spot for me to come because she understood the connection there. So yeah, that's how it happened. Like I said, it was really just attending an event. I went up, talked to Imla, and I ended up at your conference.
Awesome. And just the fact that you were so different from all the other booths really attracted me. I'm like, no, one of these things is not like the other one. Let's find out who this guy is. And once we got talking, I found out that you had at least three important messages to share with my audience. So I want to kind of tee you up for these questions. And the first one has to do with access to patients. Pharmacists have access to patients. Now, how can that help with suicide prevention?
Yeah, so that's a really good question. So, pharmacists, they have the unique opportunity, and like you said, access to patients there, and they are filling scripts and interfacing with patients. And again, I'm not a pharmacist, and I'm not as familiar with your field, but I can imagine a scenario, especially with local pharmacies, right, where you know the patient better because it just seems more personable. It's kind of a local situation, but even the bigger, name pharmacies, Kroger, CVS, things like that, I can also imagine where you have a regular patient coming in to fill scripts, and maybe they start to share some, information about their lives personally, right? Maybe they're more upbeat, outgoing, joking around. Then maybe you start to see their demeanor shift. You might start to see maybe they're not as outgoing. Maybe they even start to share what's going on in their lives, and might even go as far to say maybe they kind of hint or indicate that they are really struggling, mentally, emotionally with their mental health. And as a pharmacist, or even just as a general community member, but as a pharmacist, you may be concerned for this individual, but maybe you don't know how to respond. And especially if some of these medications might be lethal, right, or in combination lethal. And you might start to wonder, are they considering suicide, especially if there's some of that kind of indirect language. Maybe it seems like they're hinting at it but maybe not explicitly telling you. How do you recognize some of those warning signs, and how do you have a conversation with that individual, right, that you may be concerned about? So that's for those reasons. I think again, pharmacists just have that unique opportunity when interfacing with patients, especially when medications are involved. And medications are in our field one of the lethal means for suicide. And that's just kind of the jargon we use in our field. But kind of lethal means safety, right? If you know that an individual has access to any sort of lethal means, and especially if they've kind of paired it with their intention to take their lives, or that they are again displaying those warning signs, and maybe the medication is particularly lethal. I just think that it's a good opportunity to provide some training for pharmacists just to recognize those warning signs. How do you have a conversation with somebody and point them in towards the right direction? I'm not suggesting pharmacists become counselors at all. It's just more of how do we educate people who come into contact with somebody who may be at risk for suicide, and you're the one who is, you have knowledge of these lethal means, these medications, right?
Awesome answer. You covered a lot of the points that I was hoping that you would, touch on. Thank you. You're saying that if somebody is talking about something, they seem depressed or suicidal. obvious red flag, right? Or they've got behavior changes, or we as pharmacists are recognizing that there are combinations of medications that they're on that, it could possibly lead to an overdose, intentional or accidental. And then also, we didn't touch on the side effects of medications. There are some medications, for example, Accutane, that
Mm.
have, I think it's a black box warning, and it says that, this individual may be at higher risk of suicidal thoughts. So I think you hit on a lot of the points. Hope you don't mind me adding one. But then when it comes to this training that you offer, what does that look like and how can pharmacists access that training?
Yeah, absolutely. So actually, I'm glad you brought up the black box warning and the black box labels there. So yeah, absolutely, you're correct there. So I have no issue with you adding that one in. But how can pharmacists access these trainings? What do they look like? We actually have different trainings out there for different purposes. One that comes to mind is actually a really popular kind of base level entry suicide prevention 101 training. It's called QPR. It stands for question, persuade, refer. It's basically like CPR. It sounds the same and it's the same type of training. We call these gatekeeper trainings in the field where, again, somebody may be in a situation where they come into contact with somebody that's at high risk for something. And in this case, that something is suicide. And we believe that everybody has a stake in suicide prevention because oftentimes it is not a mental health professional or a counselor that somebody opens up to first. It is somebody they're interfacing with on kind of more an ongoing basis. And again, depending on how often these individuals fill their scripts, their medications, that could be, I can see at least once a month, right? In some cases, or even more frequently, depending on what type of medication. But that training, it's about 1.5 to 2 hours long. We do it virtually, and we also do it in person, depending on where you're at. In the state of Ohio, we provide these trainings, but they're free of charge. QPR is. There is no cost to participants. We actually have grants that fund the ongoing implementation of these trainings. But basically, participants just learn how to, one, recognize the common warning signs for suicide and risk factors as well. And two, how do they just have that conversation with somebody? It's difficult, and we know that people are uncomfortable a lot of times in certain situations. Asking the question, are you thinking about suicide? It just doesn't feel natural coming out. We also know that people are afraid of what the answer is going to be. If the answer is yes, right, does that mean that you might have put the thought into somebody's mind? Actually, research suggests time and time again, you cannot put the thought of suicide into somebody's mind, regardless of the situation. It's either they're thinking about suicide or they're not. You can't plant that seed for somebody, but that is one of the biggest misconceptions out there for individuals. And so this training really aims to just lower the anxiety for the person who may be concerned about somebody, have an open and thoughtful and caring conversation with someone, kind of gain their trust and then refer them to an actual mental health provider, right? Somebody who actually can help. So again, that's what I mean by like it's like CPR. You're not the actual professional in this sense of mental health, right? And counseling, therapy, but you are, somebody who's trained to recognize that there's a problem and kind of intervene in a temporary and immediate situation and then refer them to the actual professional who can take over from there. That's one training. There's another one that's very similar, but it's actually, I feel like, even more tailored to pharmacists. It's called CALM, and it stands for Counseling on Access to Lethal Means, right? And I mentioned earlier that medications, right, is a lethal means for suicide, or it can be at least, right? And this training goes through some of those same kind of talking points that I mentioned for QPR, where warning signs, risk factors, how do you have a conversation? But then it gets more into the asking the question about, are you thinking about using any particular lethal means? Or if somebody indicates that, yeah, I've thought about overdosing, right? I've thought about taking X number of these pills and just see what happens, right? And this training actually educates participants on, again, identifying what lethal means they might be. But in your case, you already are the expert. You already know what could be lethal, right? Or interactions or side effects, right? but aims to actually have a conversation with somebody. How can we kind of either reduce their access, and in this case would be, if it's a prescription written by their doctor, that's a different situation. You wouldn't necessarily be able to reduce access, but you could introduce concepts like medication lock boxes, things like that, safe storage. Or you can talk to the individual about maybe having somebody that lives with them kind of monitor their medications, and they're the ones who give them their medications, just suggesting, right, these things, just because we know that time and distance is critical when it comes to, kind of these spontaneous suicidal thoughts. If you can increase the time and the distance between a person and whatever means they want to use to take their life, we know that that's critical. It actually gives the person a second, another chance to second guess what they're about to do. Very temporary solution, but a very effective one as well.
Delay the action, interrupt the impulse. I totally
Correct.
agree. Great
Yes.
solutions there. The two trainings that you mentioned, QPR and CALM, are these nationwide trainings or are they unique to Ohio?
They're actually nationwide trainings. So the QPR Institute is a national organization that certifies trainers across the country. I myself am a master QPR trainer. I have the ability to train other instructors. But Calm, same thing. Calm America, the national organization that certifies individuals under that program.
Good to know. I appreciate you educating me about this because I have basically a global audience, and I know that not just Ohioans listen to this
Yes, yeah.
podcast. So thank you. I think that will give other pharmacists ideas for contacting their local suicide prevention organization and maybe encouraging their fellow pharmacists to get educated as well or bringing it to their state pharmacist association.
Yeah, absolutely. That's a great suggestion. We know that there are many organizations out there that provide these types of trainings free of charge. Normally, they wouldn't be free, but again, a lot of these kind of nonprofits across the country have received grant funds to be able to provide these to community members free of charge.
I appreciate that you're funded for that because, I mean, at least for Ohioans, it sounds like Ohio pharmacists could get free training. Now, one thing that I want to toss out to you is the idea that the Ohio Pharmacists Association has a brick and mortar building. I believe it's in Dublin, Ohio, technically, but it's definitely the Columbus, Ohio area. And we have a mid year meeting in November, early November, and then we have an annual meeting in April, which you have been to. So I would like to, I guess, challenge you or encourage you to set up a training in, I guess it would be early December and sometime in May, maybe mid May, if possible. And then you could be advertising for pharmacists to go to these during our mid year and annual meetings, because I think this is great training. I love that it's free and it would be easy for you to get to that building, the Ohio Pharmacists Association headquarters, and provide the training. So there you go, challenging you, Austin.
That's not really a challenge. Challenge accepted. Like I said, this is something I'm passionate about, and yeah, I'll just have to get in contact with the Ohio Pharmacists Association and see if we can get something on the books.
Absolutely. Yes. So you show up once to one event and then we're going to keep having you back.
There you go. Yeah, happy to do it. Yeah.
Awesome. Well, moving on, let's get to the second question on my list here. It has to do with pharmacists themselves. Pharmacists are at an increased risk for suicide due to access to medication and information about lethal combinations. And I'm guessing that there's a list somewhere of medical professionals or healthcare professionals that commit suicide. And I'm guessing that pharmacists are moving up the list. So I'd love to hear your thoughts on that.
Yeah, absolutely. So I actually did a lot of research here about, where various medical professionals or just occupations in general and where pharmacists might rank. There actually is not a like full on list anywhere, right, that is kind of widely agreed upon. However, I did find in my research there that pharmacists do, based on a couple of studies that have been released, because there haven't been many specifically for the pharmacy, that occupation specifically. But one of the studies actually found that it was a longitudinal analysis looking at suicide rates for the general population, from working age population from 2003 to 2018. versus looking at, pharmacists in particular and where they might rank compared to the general working population. Found in that time range that I mentioned, pharmacists on average had a rate of 20 per 100,000 individuals who have died by suicide versus 12 per 100,000 individuals. So definitely above the national average suicide rate from that time period of 2003 to 2018. And, again, probably for some of the reasons that you mentioned when you were teeing up this question, the access to lethal combinations, the access to lethal medications in general, ones that individuals might be more inclined to overdose on. And one of the leading theories in the field of suicide prevention is called the interpersonal theory of suicide. Dr. Thomas Joyner is the one who kind of coined this theory, and he has a lot of research on this theory that he's created. And there are kind of three key elements per his theory of why somebody might choose to die by suicide. Okay. It's kind of like a triple Venn diagram, if you can imagine. That's the three circles that are overlapping each other. And per the theory, these three things need to occur kind of simultaneously for an individual to attempt or die by suicide, because it takes a lot to get somebody from the point of thinking about suicide to actually crossing that threshold into the action of attempting suicide. The first one is this perceived burdensomeness. Somebody just, and it sounds just like what it is, somebody perceives they're a burden. Doesn't mean that they're actually a burden to somebody in their lives or people or the community at large. All right. That's how they perceive themselves. They think that they're a burden. The second one is thwarted belongingness, which is a weird way of saying somebody just doesn't think they belong to their community, their friend group, their family, when again, that's just kind of how they perceive themselves. It might not mirror reality. And the third, and this is what really pertains to the pharmacist population, is called this acquired capability for suicide, which means a couple of different things. One specifically is they have this acquired capability, this knowledge of lethality when it comes to medications or the combinations of the chemistry of it all, right? And that is one of the key elements. A lot of individuals who are contemplating suicide or thinking about suicide or kind of have this passive suicidal ideation, typically there's not that the capability is really when the lethality comes into play. Because like I mentioned, it takes a lot to get somebody to kind of cross that barrier from thinking about suicide to actually attempting or dying. Whereas pharmacists kind of have this knowledge, this, quite frankly, of how to kill themselves with the combinations and everything that I mentioned there. So again, per the theory, when those three things kind of happen, it's the perfect storm, if you will, perfect recipe for disaster for somebody. And again, of course, this is just a theory, but it is like the leading theory in the field with a ton of research to back it up.
Thank you for talking about the statistics and the Venn
Yep.
diagram. That's all very valuable information. And there's going to be at least one pharmacist out there who would like to quote this research that you
Mm-hmm.
looked up. So, do you happen to have the source of I think you said 20 in 100,000 healthcare professionals or medical professionals do complete suicide?
Yes. So this was actually a report released from the Journal of the American Pharmacists Association, actually, where I found this. And it is the longitudinal analysis of suicides among pharmacists during 2003 through 2018. And Kelly C. Lee was the primary author on that study. And it was published May 13th, 2022. So that is where I found that. And regarding the interpersonal theory for suicide prevention with that Venn diagram, Thomas Joyner is the author there, and the study is the interpersonal theory of suicide.
Very good. Thank you very much. I know pharmacists love data, but they love documentation too to
Of
support,
course,
like where did
yeah,
that come from? Who's your source? Because we
right,
always want it to be evidence based. And the Journal of the American Pharmacists Association is a very reputable journal.
great. And we're similar in our field too. We want everything to be evidence based, especially when it comes to the trainings. We want to prove they're actually making a difference. The outcomes have been measured and tested and peer reviewed.
Awesome. The more that I'm thinking about it, I know earlier I kind of threw down a challenge of having you line up these trainings at the OPA headquarters, but now I'm wondering if maybe OPA could create some sort of learning opportunity for the pharmacists at the annual meeting. How long are these trainings? I think you said an hour and a half to 2 hours. Am I remembering correctly?
Yeah, so actually, we can tailor it to a degree. Some of the, like I said, back to the evidence-based thing, right? It's the evidence for, base for some of these trainings have been tested for a period of, the actual training itself period of time to maintain fidelity of the model. But for the QPR training I mentioned, that can be in as short as an hour. Okay, so we can do that in an hour. It's just something that we prefer more time to allow for further conversation and engagement with the audience. It is preferred for an hour and a half to 2 hours for that one. For the calm training, counseling on access to lethal means training, we can provide that in as short as 90 minutes. So that's an hour and a half long training. And that one's actually called Calm Conversations. The reason I put that there is because there is a clinical version of Calm, but that's primarily for mental health professionals who are actually sitting down in a traditional engaging with their client or patient talking, whereas pharmacists don't fall necessarily into that kind of clinical role. And that clinical training is 3 hours. So this one, it can be shortened to 90 minutes. And that this is for a more broad audience. And I can specifically tailor it to kind of the pharmacy population as well.
Good to know. Thank you. Of the two, what do you think is the more important one to get trained on, the QPR or the Calm?
I would say calm, definitely calm, just because we're talking about the lethal means aspect and it kind of touches on some of the points for QPR anyway. Very similar. It's just calm focuses more on lethal means safety.
This is very good information, and thank you. Once this episode comes out, I will be forwarding this to the Ohio Pharmacists Association to recommend that they include this in their programming, either at a mid year meeting or at an annual meeting. Because if you can shorten it to 90 minutes, that kind of is what we do anyways for our speaking events. Either they're 60 or 90 minutes long, and they could maybe even make an exception as well. So I'm not going to speak on their behalf, but I'm definitely going to make a recommendation and send them a link to this episode. Thank you.
Of course, yeah, we appreciate that. Happy to do it if there is the interest out there.
Yes, I think there is. I think it's a popular topic now, and unfortunately, it happens, but I think people are willing to talk about it at this point. Since you have joined the Ohio Suicide Prevention Foundation, have you noticed that people are more willing to talk openly about suicide and suicide prevention?
I would say so generally, just from my kind of personal experience, in well, professional experience, but I'm not speaking on behalf of the field here, but I would say in general, yes, I see this kind of heightened attention towards mental health just in general, and especially with COVID. And if I may put a silver lining with the COVID-19 pandemic, it would be that heightened attention towards mental health issues, especially with people working from home. We saw how it affected folks and students with school, and just kind of the added stress onto the medical and I dare I say probably the pharmacy trade as well. And so yes, I have definitely seen kind of this more willingness to talk about the issue, at least acknowledge it. And now more than ever, there's this unprecedented amount of grant funding from the federal level, the state level. There's a just a bigger investment into mental health awareness, suicide prevention, and really understanding these issues and getting folks trained.
I know you used the phrase silver lining, and I call it hashtag gifts of COVID. These are the gifts of COVID. It allowed people to express what they were feeling and experiencing. So I see what you see.
Great, glad we're in agreement there.
Now, you were talking about pharmacists and experiencing more stress during COVID, right? I think that's what you were just hinting to a minute ago,
Yes,
right?
yes.
Okay, that kind of takes us to the third talking point, the third question here on my list. First, I'm going to give some background. Pharmacists are stressed. Prescription volumes are high. The number of services that are offered at the community level have skyrocketed. COVID uniquely had increased immunization counts. They had testing for COVID. There are a number of other responsibilities other than the traditional dispensing and counseling. So, with the additional services that pharmacists need to provide without necessarily having additional support, pharmacists are facing stress and burnout. And I know that when we talked back in April, you said that the Ohio Suicide Prevention Foundation recognizes the stress that pharmacists face. What would you like to tell pharmacists about any of the tools that you have and the the things that you know we're experiencing? So we know what we're experiencing, but what do you know?
Thank you for giving that overview of just kind of more background and details on the added stress, in the pharmacist field. Because, like I said, I'm not a pharmacist myself, but I would say to those pharmacists out there who are experiencing that burnout, you're definitely not alone. Definitely engage in some sort of self care activities that could honestly be as simple as walking your dog, talking to other friends. There's something in the field of suicide prevention called a safety plan. And there are actually apps out there where you can create a safety plan for yourselves. Or if you are in counseling or therapy, you can talk to your provider and they probably know what a safety plan is. I'll give an overview of what that is and why this relates to this topic here of burnout and maybe that added stress. And maybe you are having some thoughts of suicide yourself, or you're really struggling in that regard. A safety plan is a research based document that you fill out with your provider, mental health provider, but also you can kind of fill out a safety plan yourselves. And this safety plan was actually developed by two experts in the field of suicide prevention, and that's Dr. Barbara Stanley and Dr. Gregory Brown. It basically goes through a list of, at first you fill out what are the signs that you are struggling. What are you thinking about? What is kind of basically self-reflecting on some of maybe that anxiety that gets you to the point of where you're considering suicide potentially, even just having thoughts of suicide. It's kind of just recognizing kind of your triggers or your emotional activations. And then the second point is really, what are the things that I can do to distract myself potentially? You fill out again, maybe again, it's going out on a walk with my dog, it's playing some music. And then if that doesn't work, there's the third level. And if you're not, getting it, but, understanding now, it's you start at number one, at least that self awareness. And then if that doesn't really work for your suicidal thoughts, you're still kind of considering suicide in the moment. You move down to step two, three, so on and so forth. So step three is, who are the people that I can surround myself with that might distract me from what I'm experiencing? And you list names and phone numbers there. If that doesn't work, just simply surrounding yourself with these individuals, not necessarily telling these people you are having these thoughts. But step four is, all right, who are the people you can trust, who are kind of already aware that you're struggling, that you can call, you can, reach out to, go visit, and you put their names and phone numbers there. And step five, if that doesn't work, okay, who are the professionals you can call in this moment? It could be 988, the National Suicide Prevention Lifeline. It can be your mental health provider, if you have one, their names and phone numbers, right? And then also step six is, and then it goes into that lethal means safety component. What is your plan to kind of reduce these access to lethal means if you start going down that path of considering suicide? The reason this all relates to burnout and everything is, it is a plan that you've created ahead of time. There are various safety plan apps. The My3 app's just one example, but there, if you just put in safety plan apps, a list will come out. And basically it's a plan that you create ahead of time when you are kind of at a more baseline state, where you can list people, activities, professionals to reach out to, just to have a plan for when these thoughts do emerge and might be alone, right? And it's an effective short-term intervention with yourself to just distract yourself and kind of reduce some anxiety in that moment, to kind of get through when you are experiencing suicidal thoughts.
Interrupt the impulse, distract yourself, Have a written plan. I've always said I'm a big notebook user. I like to plan my day on a written notebook, and it never looks as stressful on paper as it feels in my head. And I feel like what you just said is kind of like the suicide prevention version of what I just said. Would you agree with
Yeah,
that?
I would. Yes. Yeah, that is the concept there. Yes.
It's different when you see it written on paper. Like, this is the feeling I'm having, and this is what I'm going to use to distract myself, or this is the person I'm going to call. This is all great info. And I love that there are apps available. Who doesn't have a smartphone as a pharmacist, anyways? So I think
Right.
you meet people where they're at when you have an app on a phone.
That is right.
Great info. Thank you for that resource. I know that there's a lot of stress among pharmacists. And like you said, there's an increase of healthcare professionals or medical professionals completing suicide compared to the general population. So these are definitely tools that pharmacists can use for themselves. Now, as far as other tools, I'm thinking about the Ohio Suicide Prevention Foundation's podcast. So, a tool that they could also use just to kind of hear about some other people who are also struggling. So it helps them understand that they're not the only one, and there's, other tools, other people out there to help. What would you recommend they do with your podcast?
So thanks for the shout out there. As you mentioned, Kim, we do have a podcast. We release once a month, and it is called Voices for Suicide Prevention, and it's on every major podcast streaming service. What we like to do at our organization, we actually have a theme for each month that we kind of plan out year to year. And we bring various experts, somebody with lived experience. We always like to involve somebody with lived experience as well to come on a podcast and just talk about how different issues relate to suicide prevention. They can range all the way from somebody like I'll give one example. The older adult male population actually has the highest rate for suicide. Maybe that's our theme for that month. We bring in somebody who's an expert in older adult male suicide. And then also maybe we bring in somebody for another perspective who's been impacted. Maybe their father or somebody in their life who's an older adult male died by suicide, and get their perspective on things and how they've found ways to cope with that grief and suggestions for other individuals feeling the same way. So it's just topic to topic each month. And, we have a wonderful host on our podcast. His name's Scott Light. So I recommend folks, if you want to, just tune in. Again, it's Voices for Suicide Prevention.
Thanks for sharing that. I did look it up on my podcast player. I like Apple Podcasts, so that I went to that podcast player. I noticed that there are currently 28 episodes. I think that's a good number. It started a couple of years ago. And just as a caution to any pharmacists listening to this, that check it out. If you are commuting with young, impressionable children in the car, it's not necessarily explicit, but it is kind of R rated. It's not family safe, if you know what I mean. It's a very heavy topic. It's suicide, suicide prevention.
Yeah, thanks for pointing that out. And we do have to be careful when we're talking about suicide around young kids. However, we also know that, and this is where this, does get sad for a lot of individuals. We know that some kids as young as 5 years old take their own life, and they are thinking about it and they are talking about it in some circumstances. While that is rare, we do have a lot of suicide prevention initiatives in elementary schools, middle schools, high schools, where we do talk about it. But you're right. It depends on the age of the youth and the child on how we tailor that message, right? We might not call it explicitly suicide. We might, change the way we talk about it to match their developmental age.
Right. I know the pharmacists can handle it, but I know that a lot of pharmacists commute with children in the car. And I just wanted to give a heads up that it looks like a great podcast. I have only listened to one episode, thought it was great. But again, it's not necessarily family safe.
Sure.
Yep. Watch out for those kiddos because they need to hear about it at that age appropriate level, like Austin just said. It's a very good point. All right. As we start to wrap this up, Austin, is there anything else you'd like to share about yourself or the Ohio Suicide Prevention Foundation?
Yes, I would just like to take a moment to thank you, Kim, for the opportunity to come on to your podcast and share some of the great resources that we have. However, I didn't have the time to talk about all the resources the Ohio Suicide Prevention Foundation offers. So if you're interested to see, just the whole suite of resources we have, I encourage you to visit our website, ohiospf.org, where you can find out more. And also, if you are struggling with suicidal thoughts or just feeling overwhelmed, I encourage you to reach out to 988, which is the new National Suicide Prevention Lifeline, 24/7. You can call 988, you can text 988, and you can live chat on 988's website. And they're trained crisis counselors, and they are there to help you. So, again, I encourage you to reach out if you are struggling.
Great info. Thank you so much for being here on the Pharmacist Voice podcast, Austin. Take care.
Thank you.
Okay, this is a bonus. I learned something in our wrap up conversation, and I'm going to ask Austin to share some vocabulary with you. Austin.
Yeah, thank you. And this was more of a gentle kind of conversation I had with Kim afterwards about preferred language, safe messaging, when we're talking about suicide and other issues too, just how we refer to somebody who, has taken their own life, has died by suicide. It's common that people say the phrase committed suicide or somebody, wants to commit suicide. And, that's fair. That's been around for a very long time. However, we're trying to move away in this field, and we try to educate as many people as possible on moving away from committed suicide because there's a negative connotation a lot of times with the word commit. You commit a crime, you commit murder, you commit a sin, you're committed to the hospital, and that actually might prevent somebody from opening up about what they're going through or what they're thinking about because they might fear that other people will think that they are committing a terrible act just by having suicidal thoughts, right? So for those reasons, kind of the preferred terminology is somebody died by suicide, somebody took their own life. You can even say somebody killed themselves. If, it might sound a little harsh. You don't have to say it that way. It's just one of the options out there because it's factually what happened and there is no negative connotation associated.
Thank you for clearing the air. And you told me that that's part of the training. So anybody who takes the training will learn that as well. I was born in the 70s and I was raised on TV in the 80s and the 90s. And I kind of blame what I learned in health class in, eighth grade and what I saw on television as the reason that I use the vocabulary that I do, which is committed suicide or completed suicide. It's just, I guess, how I was raised. Maybe it's a Midwest thing too. I don't know. But anyways, I think that Austin, my audience will benefit from this vocabulary lesson. Thanks again.
Of course. Thank you.
Thanks again to Austin Lucas from the Ohio Suicide Prevention Foundation for being my guest today on the Pharmacist's Voice podcast, episode 295. I don't know about you, but I learned a lot today. Prior to this interview, I didn't know about QPR or Calm. I also didn't know the stats on pharmacist suicide. The fact that that stat is higher than the general working age population really got my attention. Take care of yourselves, my friends, and work on a suicide safety plan for yourself if you're at risk for suicide. And share that information. Help somebody else with their safety plan if you know someone who's at risk for suicide. Tools and resources save lives. So use those resources yourself if needed and be a resource for anyone who needs a suicide safety plan, whether it's on paper, the old school, old fashioned way, or on a smartphone app. And also listen to or share the Voices for Suicide Prevention podcast. I also liked at the very end in our wrap up, Austin gave a reminder about the National Suicide Prevention Lifeline, too. The number again is 988. 988. Program 988 into your phone today. Use it if you need it, but also share that resource with others as well. Thank you. And one last thing as I wrap this up. This week, I will be sending a letter to the Ohio Pharmacists Association, otherwise known as OPA. Suicide prevention training and resources could help my fellow Ohio pharmacists and then have a ripple effect out to our fellow Ohioans and patients. If you feel inspired to advocate for suicide prevention training in your home state, I know this podcast is listened to all across America and beyond. Reach out to your state pharmacist association today. I am sure they would love to hear from you. Email them, snail mail them, just reach out. Suicide prevention training and resources are important. Let your state pharmacist association know that you are interested in attending a training. Thank you. That's all I've got for you today. Thank you so much for listening to the Pharmacist's Voice podcast, episode 295. To find the show notes, visit thepharmacistvoice.com. Go ahead and click the podcast tab and search for episode 295 to find the show notes for this episode. In the show notes, you will find links to the Ohio Suicide Prevention Foundation's website and social media channels, the Ohio Pharmacists Association website, my social media links, and more. LinkedIn is my jam. I love that social media channel, so feel free to reach out to me on LinkedIn and connect. Kindly share this episode with your fellow pharmacists and your state pharmacist association. And if you like this podcast, come on back, subscribe to or follow the Pharmacist's Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. Thanks for listening today. I will talk to you next Friday.